Hi, my name is Kelly Cordova and this is my client Taylor Dodge. I will be taking her through the preparation for the graded exercise testing. If anything were to go wrong during this test, the emergency plan would be consult with our professional staff as well as having AEDs at hand. We check the temperature of the room just to get started. It's set at 75 degrees. The humidity is a little high due to the weather outside and what's happening tonight. Before my client came in today, I had her fill out paperwork, so we are going to be reviewing over that, and we already have. The paperwork I had her do was she filled out a Part Q, which is a physical activity readiness questionnaire. This shows the health benefits of regular physical activity are clear and that more people should engage in physical activity every day of the week. Participating in physical activity is very safe for most people, but this questionnaire will tell us whether it is necessary for her to seek further advice from her doctor or a qualified exercise professional before becoming more physically active. Some of the questions include if the client has any history of arthritis, back problems, cancer of any kind, high blood pressure, respiratory disease, spinal cord injuries, or any other major medical problems that could prevent the exercise. After reviewing the sheets with her, she has nothing in there that would be a concern, and on the last page she did sign off showing that she does approve of participating with the graded exercise testing. Next, we went over her medical history questionnaire, and after going over that with her, she didn't have any present medical history that was of concern. Her family medical history is great. Her mother is in excellent health. Her father is in excellent health. There's no family diseases shown. And she's not a smoker and she doesn't drink. She loves the diet that she's in right now. She doesn't want to gain or lose weight. She is 21 years old and she weighs 132 pounds and she eats 3 to 4 meals a day as recommended. She has a good body fat percentage, low blood pressure, great heart rate, no hypertension. Her HDL is at 61 milligrams per deciliter, and her LDL is at 80 milligrams per deciliter. She's not currently on any cholesterol medication. There's no sign for any pre-diabetes. So overall, she's in excellent health, and we know that from looking over her Part Q and her medical history. She is active and works out at least 4 times a week, 5 times really because of volleyball, and sometimes even 6 due to like tournaments on the weekends. So going through the informed consent page, the purpose predicts cardiorespiratory fitness, customized design of exercise prescriptions, and evaluates the effectiveness of exercise programs. We will monitor heart rate and rate blood pressure responses, and the explanation of the graded exercise test is performed on a cycle ergometer. The workload is increased every few minutes until exhaustion or until other symptoms dictate that we have to stop the test. I will stop the test at any time because of fatigue or discomfort of her. The risks and benefits would be changes that may occur that we would need to look out for. The changes include abnormal blood pressure response, fainting, irregularities in a heartbeat, and a heart attack. Every effort is made to minimize these occurrences. Emergency equipment and trained personnel are available to deal with these situations if they were to occur. These tests allow us to assess their physical working capacity and to appraise your physical fitness status, and the results are used to prescribe a safe, sound exercise program for them. Records are kept strictly confidential unless consent is given for this information. There is voluntary participation to do this test, and now I'm going to ask my client if she has any questions. Do you have any questions? All right, I will next have my client sign this piece of paper, which is the informed consent, just letting her know that, the possibilities of anything were to go wrong and stuff like that. Could you just sign that for me? And next, I will go over the RPE scale with my client. The RPE scale is used during the exercise testing. The original scale is 6 to 20, and the revised scale of 0 to 10 allow clients to rate their degree of exertion subjectively during exercise and are highly related to exercise heart rate and VO2 maxes. Both RPE scales take into account the linear rise in heart rate and VO2 during exercise. The revised scale also reflects nonlinear changes in blood lactate and ventilation during exercise. Rating of 6 on the original scale and 0 on the revised scale corresponds to no exertion at all. Ratings of 10 on the revised scale and 19 on the original scale usually correspond with maximal level of exercise. Moderate intensity exercise is rated between 12 and 14 on the original scale and rated 5 to 6 on the revised scale. And then before the test starts, we will take her heart rate. We will do palpation today because we don't have any heart monitors, Fitbit, Apple Watch, or anything like that. So the way to do the heart rate is that I just take her radial side nerve, I feel the blood flow, and I record it for 15 seconds, and then you just multiply it by 4. So I got 14 heartbeats in 15 seconds, and then you multiply that by 4, and it'll give you 56. So heart rate, resting heart rate is perfect. And then before the test starts again, we will take her blood pressure, which we will do here. Flat, please.
You have
Big
swole
guns.
arms. You are huge.
Alrighty. And so when you take in blood pressure, you want to fit it to where you can still feel heartbeat and as you're inflating the cuff. And the first number here is the systolic number, which is the top number, and then the diastolic is the bottom number. And then the way you do that is you pump, 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 and then the first moment you hear a heartbeat, that's your top number, and once you start releasing air, the moment you stop hearing a heartbeat is the bottom number. And her blood pressure was 121/62, which is perfect to get the test started. In order to get the graded exercise test started, as mentioned before, it is on a cycloergometer. So what you do to get the client seated comfortably and in the right fixation is you have her stand next to the bike, and then you feel right about the hip areas and about just an inch, inch and a half below is where you want the top of the seat to be. So whenever she gets on the bike, then when she pedals, you have to hold on to both hands, please. So whenever she pedals, you get about a 5-degree knee flexion at the bottom, which is perfect. But the only restraint, really, the only concern through the entire test is keeping the back straight the entire test while having your hands on the handlebars, and then just pedaling as the workload increases. The reasons for stopping the test is what we have mentioned before, with fainting, heart attack, heart rate getting above the maximal zone, or blood pressure getting too high. And that is how you prepare someone for the graded exercise test using the cycloergometer.